Hello dear learners, my name is Jones Muna. Today we are discussing meningitis in children. Meningitis is the condition of the central nervous system, in which there is inflammation of the meninges outer layer covering the brain and spinal cord, caused by microorganisms such as bacteria, viruses, fungi, characterized by fever, neck stiffness, fit and altered level of consciousness. Normally, the brain and spinal cord are covered by the meninges. The meninges are arranged in three layers, thus, dura mater, arachnoid mater, and pia mater. The layer that touches the brain tissue is called the pia mater. The following and middle layer is called the arachnoid mater. The outermost and toughest layer is called the dura mater. The space between the skull bones and the dura mater is called the epidural space. The space between the dura mater and arachnoid mater is called subdural space. The space between the arachnoid mater and pia mater is called subarachnoid space. Cerebrospinal fluid (CSF) circulate around the brain and spinal cord via this space. Cerebrospinal fluid assists the brain and spinal cord by providing protection, nourishment, and waste removal. Blood vessels of the meninges are highly selective of what substances should pass through to the brain from the bloodstream in order to prevent circulating toxins in the bloodstream to reach the brain tissue that could cause infections. Instead, they only allow passage of vital substances such as oxygen and nutrients. This barrier is, henceforth, called blood-brain barrier. In most cases, meningitis is caused by an infectious agent that colonizes and disrupts this barrier from elsewhere in the child's body. For example, an upper respiratory tract infection, the virus bacteria may travel via the bloodstream from the respiratory tract to the brain and cause infection. Microorganisms can then gain access to the central nervous system and finally into the cerebrospinal fluid. The infection spread quickly through the CSF that circulate around the brain and spinal cord. Microorganisms infect the meninges. The meninges as a result become inflamed as the immune system begins to fight off the infection. The inflammatory process leads to fever, meningeal irritation causing neck stiffness, irritability, photophobia, headache, confusion, and Kernig's sign and Brudzinski's sign are positive. Acute hydrocephalus may result in severe cases due to exudate from the inflammatory process blocking the small passages of CSF between the ventricles. Thanks for watching this video. Kindly share and click subscribe button for more educative content.